turning its gears.
Yeah, I'm watching. Greetings, everyone. I'm Catherine Page with Social Change Warriors, and we are a group of social workers, and we work together on creating information to share with our communities about the grand challenges that exist in this world. And one of those grand challenges we're going to be talking about tonight has to do with maternal mental health. This is Mental Health Awareness Month, and we have a fellow social worker, colleague of mine, who's going to be with us tonight, Anna Ribeiro. She's going to be talking to us about maternal mental health. So we are so glad you're here. If you're watching this, you have obviously found your way to our YouTube channel, Social Change Warriors. We also have a website, and we would love for you to visit us. And if you have any training requests, we have a team of 9 social workers versed and trained in all areas of the grand challenges, and we would love to help you out and give you some training. So we're looking forward to meeting you in the future, and I am going to be running tech behind the scenes tonight. So hopefully everything will go smoothly for Anna. I'm sure it will. And I think you're going to be really impressed with the amount of information that she has researched on this topic, and very stunned by some of the statistics and facts that she's going to share with you tonight. So Anna, it's all yours. Take it away.
Thank you, Kat. I'll switch over to my presentation over here. I am Anna Ribeiro. So we are in Maternal Mental Health Awareness Week this week of today's May 3rd. Tomorrow is Global Maternal Mental Health Awareness Day. So this is a very timely topic. Let's see, I do have my licensed master social worker. I graduated from University of Southern California 2 years ago, and I had my first daughter in August of 2020. So this is a topic that's very near and dear to my heart. I am one in five women who suffer from postpartum depression and anxiety. This is something that I have, lived through and come out the other side. And so it's something that I'm really passionate about, to share all of this information with people who might benefit from it. So I'll go ahead and get started, just jump right in. We're going to talk about something called PMAD. So it's not just postpartum depression anymore. So we'll talk about some different perinatal mood and anxiety disorders, some risk factors, statistics about who is affected, as well as some treatment strategies, coping skills, and what we can do about this issue in the future. So, like I said, it's not just postpartum depression anymore. That is probably the most commonly known and most well talked about issue, but we're talking about the whole perinatal period. So anytime from pregnancy to a year postpartum, any of these can surface at any time. When we're talking about mood, we're talking about depression, bipolar disorder, and psychosis. When we're talking about anxiety, there's general anxiety, there's panic disorder, obsessive compulsive disorder, and post-traumatic stress disorder. And disorder, we mean that it interferes with day-to-day functioning. So it's not just something there in the background, but it's really affecting how you interact day to day. And so many people may not know that perinatal mood and anxiety disorders are actually the #1 medical complication related to childbearing. This is something that is detectable. There's screening tools. During pregnancy, you have, 10 to 15 visits with your OBGYN, and that is the perfect time to be screening for these issues, as well as the postpartum checkups. Those are ideal times for intervention. And if untreated, which most, probably 75% of cases are untreated, there are some consequences, and They can be as drastic as suicide and infanticide. That is much less common. More often, you're just going to see someone that says, I just feel like I missed out on the first year because I was so depressed or I had so much anxiety. And that's something that is avoidable. So I want to talk a little bit about the expectations of becoming a new parent. And this is my experience. You have this idea in your head of you're just going to have this perfect little tiny baby and you're just going to love them and cuddle them and everything's going to be great. And sometimes things like a global pandemic happen or, just it's not what you expected. You're not sleeping. You're not happy. You have all of these emotions. You're not getting the laundry done. And you had this expectation of being the perfect wife and the perfect mother. And that just all goes out the window and you're left wondering, well, who am I? What do I do? And so I have this quote: the prevailing notion that mothers should endlessly radiate joy paradoxically keeps them feeling sick longer. So this idea that you can do everything and be perfect actually makes it so much harder on yourself. So I want to talk a little bit about some myths that exist around postpartum depression and these mental health concerns for new mothers. So like I've said, and like I'll keep saying, it's not just postpartum depression. So these things can occur anytime during pregnancy or postpartum, and they are not just for new moms. It can also affect partners. It can also affect adoptive parents. And there are sometimes these ideas about it's going to be so easy or so hard to get pregnant and pregnancy is going to be smooth sailing, when in reality, 50% of pregnancies are unplanned. There are things like mom gets sick, baby gets sick. There can be complications that are unexpected, and just that expectation of things are going to be no problem. It can be really, really challenging. There's this culture of, I'm just going to bounce back right after having a baby, when in reality, it takes time to recover physically and mentally and emotionally. There's also some stigma around mood and anxiety disorders during pregnancy and postpartum, because there's this idea that you are going to harm your baby. And that's just not, it's not very common. It does happen and it can happen, but for the most part, you're not going to harm your baby just because you have postpartum depression or postpartum anxiety or any of these other mood disorders. And I also just want to say that these are treatable. It's treatable with support and skills. And if you leave it to just go away on its own, you risk missing out on all of these enjoyable moments because you're not in a place to be able to enjoy it. So as I've been saying, postpartum mood and anxiety disorders are very common. So sometimes you hear the statistic that 1 in 7 women suffer, and sometimes you hear 1 in 5 women suffer, and they're actually both true. So 1 in 7 women will suffer during the first 3 months postpartum, and 1 in 5 in the first 12 months. There's also increased rates for women of color. So 1 in 3 women of color will develop some kind of postpartum mood and anxiety disorder, as well as 1 in 10 fathers. So if you add it up, that's about 600,000 people in the US every year suffering from these things, and most of them are not getting help. So some of the risk factors for developing a perinatal mood and anxiety disorder, I put them into a couple of different categories because there are different types of risk factors. So if you have a personal history of mental illness or one of your immediate family members, that can be a risk factor, as well as other medical conditions such as diabetes. There's a lot of life stressor risk factors. So if you just had a recent divorce or a death of a loved one, if you're a single parent with financial hardship, a history of trauma, those can all be big risk factors for postpartum mood and anxiety disorders. Other risk factors that maybe are not as expected, unplanned and unwanted pregnancies, infertility treatments. People who have undergone IVF are at higher risk, as well as if you've had a traumatic delivery, a baby in the NICU. There is some research in breastfeeding. So if you're not breastfeeding, you might be at higher risk. Those kind of work both ways, which I'll talk more about later, as well as age can play a factor. So under age 20 and over age 40 are at higher risk. A word about COVID-19. We have seen the rates of postpartum depression and anxiety go up to 1 in 3 moms during the early stages of the pandemic. And that's huge. So some of the factors that are contributing are social isolation, that fear of what if baby gets sick? What if mom gets sick? What if I can't have my support person in the hospital? People losing their jobs, the threat of losing their jobs or their homes. International family members not being able to come visit, as well as support groups not being as accessible. Not to mention for Black and Hispanic populations, there are higher risks of COVID-19 complication. And the people in these communities also have higher risk of experiencing a loss of someone close to them. So these are all contributing factors. I'm sure there are so many more, and this is just beginning to be studied. But as I mentioned, my daughter was born August of 2020, and it was very stressful, and it continues to be very stressful. So those are some of the risk factors. Here's some good news, some of the resilience factors. So if you do have social support, if you have mom friends, and if you have a supportive partner, those can all be protective factors. As I mentioned, breastfeeding might protect against postpartum depression. So this is something that's bidirectional. If you are suffering with postpartum depression, you're less likely to be breastfeeding. And reverse, if you are breastfeeding, you're less likely to be suffering from postpartum depression. So they work bidirectionally. Additionally, exercise is associated with lower anxiety and depression. I would like to say getting enough sleep, but that's really not that common for new moms. So I know that's a lot of information all at once. So I want to take a break and see if there are any questions from the audience, any questions or comments about this topic. So I'm going to switch the view over so maybe we can see some others. And there is a chat box as well. So if anyone has anything, I'll just give a minute or two just to see. And if not, we'll just keep moving on.
Great.
You know,
awesome.
I'm kind of speeding through things. So I give everyone a second to kind of catch up.
Yeah. Well, it's a lot of information so far. It's really useful and very knowledgeable. And so many of the things you touched on as a mother of 2 sons, I completely relate to. I'm considerably older than you, so it's been a while since I had my children. But there were a couple of things you said that really resonated with me. I really do recall right after my second son was born that I was feeling anxious and guilty because while I was in the hospital, I was missing my older son, who was only 2 at the time. And it was the longest I'd ever been away from him since he was born. And I remember just laying in the bed and just sobbing. And the nurses came in and said, "What's wrong? Everything's great. Your baby's healthy and happy, and he's sleeping in the NICU area, obviously." And I said, "I miss my son. I want my son here, my little 2-year-old Zachary." And she said, "Well, let's get him here." And so we called my mom, and yeah, the nurses were fantastic. We called my mom. She brought my little Zachary up to me, and he climbed in the hospital bed with me. And then they brought the baby in, and he was so good with the baby. And that was it for me. Because before that, I was just feeling almost sick, like heart sick, because I didn't feel I was bonding with my new baby. And it made me feel like a terrible mother.
Those emotions right after giving birth, your hormones are just all over the place. And it's, some things hit you that you just didn't expect.
Yeah. My youngest son is 30, almost 34. And I will never forget, I felt like the worst, terrible mother because I wasn't bonding with him because I missed my older son so much. And I wish we knew like how many other mothers, have gone through that. Cause I don't think it's anything I was prepared for. I certainly didn't think of it.
Right.
Yeah. So, but I think there's a lot of things that happen to women that we keep to ourselves because, sometimes we're taught to keep things to ourselves and not share. And like you were saying, it's supposed to be this perfect, happy time. You have a new baby, you're a new mother, and you're almost afraid or embarrassed to admit that you're feeling sad and hopeless at times. But it's not,
Absolutely.
Should not be embarrassing. Your body has been through so much. You're a new mother, even if it's your second or third child, you're still a new mother at that moment.
Right.
And I think people forget about that too. No matter how many children you have, you are a new mother in that moment.
Exactly. So we have one question in the chat, how PMAD changes after multiple pregnancies. And so there is some information, basically every pregnancy and every postpartum is different. So even if you've had one great pregnancy, one great delivery, one great postpartum where you had no issues, your second one, totally different story, or vice versa. So just like every pregnancy is different and every baby is different, every postpartum is different. You are at greater risk at your second postpartum period if you have a previous history of postpartum depression or anxiety. Then you are at greater risk for that second pregnancy. But there's no hard and fast rule like, oh, if you had it before, you're going to have it again. That's not necessarily the case.
Great question from the audience.
Yes. And then our other question in the chat. Sorry?
Whose question was that, Anna?
That was Amber.
Oh, great question, Amber. Thank you.
And then another question from Betty. Are there any reasons for people of color to have additional stressors? So I cover this a little bit later on, but I will say for people of color, it just increases your risk of risks, essentially. So you are at higher risk to be lower income. You are at higher risk to have pre-existing health conditions. You are even just being a person of color, and this is really unfortunate, you're at higher risk for maternal mortality or infant death. And those things all play a role. And again, every situation is different and every person is different, but that does increase the likelihood that these conditions will come about.
Good. Great question from our audience tonight. Thank you so much. Anna, when did you first realize that something was just off?
For me, it was actually during pregnancy. So we were on lockdown for many months before this, but I was probably into my third trimester when I was just worried, just anxious about everything, worried about everything. I wasn't leaving the house. Of course, it was a global pandemic, so that's kind of a different situation.
Right.
But I was too nervous about getting COVID, about not being able to have my husband in the delivery room. And so for the last couple of weeks, we didn't go anywhere. We didn't see anyone. And I remember I joined a support group that was offered by the hospital that I delivered at. And the facilitator of the support group encouraged me to discuss this with my OBGYN. And I remember bringing it up to her and just saying, like, I'm just really anxious. I'm just feeling a lot of things and I don't know if this is okay. And she told me, well, we'll just keep an eye on it, and that was it. No further discussion. No, how should I manage this? No. And she didn't ask me about it again. And I really liked her. She was a really good doctor, but it's just not that common to be involved in that aspect. And so that's something that I would really love to see shift.
Absolutely. You would really think that your primary care, OBGYN doctor, that would be on their checklist, like an important piece of their checklist. But I think you found, and I would bet a lot of other women have found, and I don't recall my OB ever asking me about feeling anxious or feeling depressed in any checkups prior and after the delivery of either one of my sons.
Right. And I will say that after I delivered my daughter, there was a social worker that comes around and checks on all these new moms, and they give you a screening. At least in where I delivered, they gave me a screening for postpartum depression. I scored pretty high because I think I was already having those symptoms, even during pregnancy.
Right.
But there was no follow-up. So they just give you the screening and they say, oh, there are resources if you want them, but there was no kind of follow-up, and that was pretty disappointing to me.
Yeah, very, very disappointing. Well, this is just a lot of great information. Thanks again to Amber and Betty. They're actually part of our team, our Social Change Warriors team. They're both master degreed social workers, and they're joining us tonight just to ask questions and keep the conversation flowing for those of you that will watch this back on the recording. So, all right, I'm out of here, Anna. Let's go.
Okay, we'll keep rocking and rolling. So, as I've talked about, again, not just postpartum depression. I know I'm tending to say postpartum depression because that is, it's the most common and it's the first thing that comes to mind. I'm not doing presentations all the time, but there are different kinds of perinatal mood and anxiety disorders. So the bolded ones that you see on the screen are the ones that I will cover in this presentation. The rest will be a part 2, if you will. So the baby blues I don't know if it technically qualifies as a PMAD, but it is very common and it's worth discussing. Postpartum depression, perinatal depression, that is obviously the most talked about. Anxiety and panic disorders. Postpartum OCD is very misunderstood, misdiagnosed. Post-traumatic stress disorder is very common. Bipolar is a lot more common in the postpartum period than it is in the general population, which is worth noting. Psychosis is kind of linked to bipolar, but again, that's a discussion for a different day. And then partner depression. So I just thought this quote was just so spot on. One of the worst parts about the symptoms of postpartum depression and anxiety is that they don't feel like symptoms. They feel like who you are. And that just really sums up the experience. It doesn't feel like it does. It feels like who you are. So I'll leave it there. So the baby blues. This is very, very common. Just like Kat and I were discussing, the hormones during pregnancy are so high, and then you give birth and they drop and your emotions are all out of whack. And so it's normal for the majority of women to experience some postpartum baby blues. The thing to remember about the baby blues is that it usually lasts 2 weeks. If it lasts longer than 2 weeks, it is something more. So if you're going to remember anything, remember baby blues, only 2 weeks. And this does typically resolve on its own. And after around 3 weeks, a month, if it's not going away, it could be postpartum depression or it could be something more. I forgot to mention, but this is important too. This isn't just specific to women. Up to 25% of men also experience some normal baby blues. So moving on to depression during pregnancy and postpartum. it is similar to any other kind of depression, but during the postpartum period, there are some characteristic feelings about your baby or that kind of thing that are characteristic of postpartum depression. So this is a lot of information here on one slide, but I just felt like it was all so important. So there are different kinds of depression symptoms. So there are the emotional symptoms where you feel sad and hopeless. You can't stop crying. You just feel so overwhelmed. Maybe you're angry. Maybe you have postpartum rage. That is a real thing. Maybe you just feel inadequate or guilty or shameful about these feelings. So the emotional symptoms are just a part of it. You may also have mental symptoms like difficulty concentrating or making decisions, remembering details. You might think you have failed. And then physical symptoms are could be changes in appetite, could be trouble sleeping, could be fatigue, could be headaches. The trouble sleeping is a little tricky because if you have a new baby, you probably aren't sleeping that much anyway. But to me, I think of trouble sleeping like while the baby is sleeping, are you able to sleep? And then some of the behavioral symptoms, these ones I think are particularly telling, especially if you have someone that you care about. These are some of the things to watch for. Inability to bond with baby. Maybe you just don't have that connection with them and you're just not there. Wanting to be left alone with baby. You might be withdrawing or acting distant. Your depression might manifest as anger, as rage. You might be lashing out. And those are all normal symptoms that can occur with postpartum depression. So anxiety kind of gets lumped together with depression a lot of the time, but it is believed that up to 50% of cases will occur together. So sometimes people experience depression and anxiety. Sometimes it's just anxiety. They are two distinct things, but they do have some overlapping symptoms, and they can occur together. But it's harder to tell the true rates because they are lumped together so often. But statistically, they tend to be kind of on par with postpartum depression. So again, some of the symptoms to watch out for. The symptoms for anxiety are more constant worry, constant nervous energy, feeling on edge, maybe being really irritable and frustrated. Maybe you have just that restlessness and a lot of tension. Some of the mental symptoms include nervous thoughts. I'll talk a bit more about intrusive thoughts because that can play a really big role in postpartum anxiety. And then again, some of the same feelings of inadequacy, inability to concentrate. Some of the physical symptoms for postpartum anxiety might be an increased heart rate or a shortness of breath. Just that feeling of being on edge can manifest. You might also have that inability to sleep. So again, if your baby is sleeping and you are just unable to sit still, that could be a symptom of postpartum anxiety. And then again, some behavioral symptoms. Some of these might include avoiding situations. This is kind of personal, but for me, I didn't even want to take my daughter to the grocery store, not even because of COVID, but because in my mind, I'm thinking there are so many mass shootings in this country. What if something happened at the grocery store? I'm just not going to take her. I'm going to go by myself. And that for me was one, it should have been a red flag to someone who knows. And then there are things like double or triple checking. Is the car seat buckled? Did I put away all the sharp objects? And then again, that irritability and lashing out could be a symptom of postpartum anxiety as well. So again, I want to circle back to intrusive thoughts, because this is something that is really common. I wouldn't say it's normal, because it's not part of your normal psychological functioning, but it is common. But so many people don't talk about it, and so it can feel like you are going crazy. So these are unwanted thoughts that come into your mind, often out of nowhere. It can be thoughts or images. They're usually scary and disturbing. But the thing is, if they scare you, it's usually because you don't want it to happen, and you will take extra measures to make sure that you don't harm your baby. But common types of these thoughts are accidents and injuries. So what if my baby fell down the stairs? What if my baby drowned in the bathtub? Or maybe you're giving them a bath and you can picture so clearly the baby dead in the bathtub. That can be a really scary, intrusive thought. There's also thoughts of intentional harm. So you're getting frustrated, and you can just picture yourself strangling or shaking the baby. And then you think, why did I just think that? I don't want to do that. And it can be really disturbing. Other kinds of intrusive thoughts are sickness. So what if your baby gets really sick? What if you get really sick? Or they can be sexual in nature. So you're changing the diaper and you have inappropriate thoughts, and it really bothers you. Like, why did my mind even go there? It can be really difficult to talk about these. It can be really difficult to say, hey, I'm having some weird thoughts, and these things just keep popping into my head and I can't control it. It can be really hard to bring that up, even in a therapeutic setting, or in a doctor's office, or with one of your friends. But this is one thing that is very common, and there's a lot of stigma around it, because there's this thought that, like, oh, if I thought this, like, someone's going to think I'm going to hurt my baby, and that's really not the case. So I just wanted to give a note to those, because it can be one of the one symptom of anxiety, as well as of postpartum obsessive compulsive disorder. It can also be a symptom there. So I'm talking about all of these symptoms, but when you're in this period, or if you know someone or love someone, or if you're working with someone who's going through this, they're not going to come up to you and say, I think I have postpartum depression. I think I have postpartum bipolar disorder. They're going to say, I just don't feel like myself. They're going to say, I'm just overwhelmed. They're going to say, I just keep lashing out and I can't figure out why. Or they're going to say, they just feel alone. And these are all, those to me would be red flags. So those are things, if your best friend just had a baby and she's saying, I just don't feel right. Talk to her, let her, tell her that you are there for her and you want her to feel supported, and whatever you can do, whatever that means to her, because it can feel impossible to ask for that help. And so those are just some things to watch out for. The other thing I have to mention is it's not just moms. So this does affect men as well. So 1 in 10 fathers, it has been found to experience postpartum depression or anxiety. But this actually increases to 1 in 2 if their partner has perinatal depression. So some of the symptoms for fathers can look a little bit different. They might have some of the traditional symptoms like changes in sleep, appetite, but they don't have any of those. They don't have as many typically of those emotional symptoms. They might have more anger, more outbursts, even violent behavior. They might be more irritable. They might be withdrawing or working more or working less. And those can all be things to look out for in partners as well. So again, a lot of information to digest. So I just want to take a break. Like I said, there are a lot more disorders than just the ones that I'm speaking about today. But again, that's a discussion for a different time. But I will, of course, if there are any questions about any of these, I'm happy to answer them now.
I'm really glad you brought up the information about fathers going through this, because for, it's the father's first time having a baby too, or, if it's multiple children, again, it's your first experience with another new baby. And I'm really glad that you did the research and found out information about that as well.
Thank you. Yeah, and it's becoming more commonly talked about, but yes, it's a huge transition for them too. And there are things like there's not as much connection between the mother and father anymore. There's no more sexual relationship. There's no, there's not that intimacy, and that can be a factor. Or maybe they have to step up their work. Maybe they have more demands because mom is staying home. Right. And there are a lot of different factors at play, but it definitely can't be overlooked. And especially when mom is suffering, it's a lot more likely for dad to be suffering too.
Oh, absolutely. Absolutely. Let's see do we have any more questions? It looks like, Betty, was there any information about siblings showing any signs?
Siblings, like if I had a baby, my sibling, or the baby's sibling?
Oh, let's see if she...
Sorry, I'm just not sure I'm understanding.
We'll wait till she clarifies that.
Yeah, because there's family history, and then there's also, if you have multiple children.
Right.
So it can, if mom has postpartum depression or anxiety or any of these, it can affect her ability to bond with the baby. So it might affect that emotional attachment. Mm-hmm. I don't know of any studies that have been done, like long-term studies to see how it affects the babies, or siblings. That's something that I would have to look into a little bit more. That's a really good question.
Yeah, really good question. And Amber just said, great information. She doesn't have any new questions, but great information. And it absolutely is great information. This is just so needed, and just really brave of you to talk about it and share it, especially since you went through it and experienced it yourself.
Thanks.
Yeah. Well, I guess we're near the closing, so I'll go back off screen and let you wrap it up.
Okay, thanks. So there are some different strategies, and of course, I've said before, every situation is different. So treatment is going to depend on the severity. It's going to depend on if you're in a position to get help. So I want to talk about some of the treatment barriers. So it's really hard to nail down and determine how many people actually get help, because obviously you can't count the ones that are not being helped. So you see different statistics, like 15% of women receive treatment, 25% of women receive treatment. Postpartum Support International, which is a pretty, reputable source, they say 40% of depression and anxiety cases are diagnosed by a medical professional. And of those 40%, only 60% seek treatment. So it's hard to seek treatment. It's hard to get help. You just had a baby. You don't have time. You don't have anyone to watch the baby. Maybe you don't have a ride there. Maybe it costs too much. And then there are those voices that say, they're not going to understand. They're going to think you're crazy. If you're really in a depression cycle, maybe you don't even think you deserve help. Maybe you don't even want help. Maybe you can't even get off the couch. And those are very real barriers that keep a lot of people from getting the help that they need. Again, back to some other factors, racism being a really important factor. As we talked about, women of color are at higher risk. They're also less likely to receive care. again, racism increases the risk of risks. So limits to economic opportunity, limits to social resources, increasing exposure to dangerous work and living environments, poverty. These are all real factors that make women of color at higher risk and also help stop them from getting treatment. We can't talk about this topic without saying African Americans have the highest rates of infant mortality, the highest rates of adverse birth outcomes, the highest rates of maternal mortality. And these are systemic factors. These are things that it's not one individual thing that contributes. It's a system that has been racist, and these health disparities are unfortunately just something that exists, and we have to be aware of that. So for those that do seek treatment, there are a lot of options. So again, 50% of mothers may not be diagnosed. It is probably even more than that because they're not being diagnosed. We don't know for sure. So for treatment options, oftentimes therapy and medication are two of the most useful tools. Those can be combined. But if you are a breastfeeding mom, there are some considerations. Sorry, my dog is a little excited out there. So you can do outpatient treatment. You can do inpatient treatment, psychiatric hospitalization for really severe cases, especially for postpartum psychosis. And then, so screening, we have to talk about screening. It's a tool to see who might need further treatment. So I mentioned when I delivered that they did a postpartum depression screening, but then nothing was ever done with it. But I did want to share some of these, the tools for screening, which have been validated with postnatal populations. The PHQ-9 is pretty commonly used, and the Edinburgh postnatal depression screen. That is something that I would love to see incorporated across the board at that postpartum checkup and even at your child's pediatrician visits. Some of the non-medication coping strategies that are used, support groups. It's huge. There's a Postpartum Support International, and they offer weekly support groups, and a lot of different kinds. Support groups for adoptive parents, support groups for birth parents, support groups for bereaved families, a lot of different, even support groups for dads. So those can be really useful if you are trying to do the non-medication route, or oops. There we go. Even cuddling your baby. This is something that it sounds silly, but it can really help. It can really release oxytocin.
Anna, I'm sorry to step in, but we have about 3 minutes. So okay. I just wanted to alert you to that.
Thank you. And then one other thing that can really affect improvement or going the other direction is weaning. So if you're breastfeeding and you're starting to wean, try and do it gradually if possible, just to avoid the sudden shift in hormones. And then I would just say, ask for help. Ask for anyone that'll listen, anyone that you feel comfortable bringing that up with. I'll close with this. We spend too much time worrying about if a new baby is sleeping well, eating enough, or crying too much, and not worrying enough about if a new mom is sleeping well, eating enough, or crying too much. So I just want to say it's, there's a new baby, everyone's excited. But it's important to focus on the mom too, to ask her and really listen to how she's doing. That's something that I hope everyone can take away from this. And then I do have some resources listed. These can be shared with our participants here. I can share these. because the links obviously are not clickable while we're looking at the slides. But for immediate help, there's Postpartum Support International. They have a helpline in English and Spanish that you can call or text. And then for if you're having thoughts of harming yourself, the National Suicide Prevention Hotline is always there.
Fantastic. And that brings me to my point that I wanted to share that I mentioned earlier that I was going to bring up at the end, is that Anna's going to prepare a workbook, almost like a catalog with all this information. And we will have that on our website, and where if you want to purchase it, or if you want to have Anna speak in person at any of your events and do this webinar live, she will be considered doing that as well. And we will have the recording of this webinar on our YouTube channel, socialchangewarriors.org, and on our website. So please feel free to visit us and check out this recording, share it with others that you feel can benefit by this amazing amount of information that Anna has shared with us in this webinar today. And she will also be doing a documentary. I'm going to direct and produce a documentary with Anna about the struggles and the reality of what happens to moms who go through this perinatal, prenatal, and postpartum anxiety and depression. And we will have information on when our documentary will be released for a screening within the next 6 months, approximately. Anna, thank you so much for all the time you took to put this together. I know how much research you had to do, all the work it took to compile this information in a logical fashion so that those of us who have never heard of it or didn't know about it can have more of an understanding. So thank you so much.
Thank you. I know it's so much information, and this is really like only half of what I have put together. There is so much more here, and there's, of course, like I said, this is something that it's very important to me personally, and I'm just happy to share it with as many people as I can.
Wonderful, and we'll look forward to the part two.
Yes, thanks to everyone who was able to join. Thank you, Kat, for moderating, and everyone for the questions, and
absolutely,
and for listening.
Great, and thank you to our team members, Betty and Amber, for being in our chat box tonight and joining us. And please check us out, socialchangewarriors.org. And I hope you all have a blessed evening and take care of yourselves out there. It's a tough world right now. Thank you. Good night.